Then after that we have to understand the like the ionizing radiation toxicity in our body. So first of all, you guys know this thing. When you are going to get the ionizing radiation, I already explained in the free radical injury, these ionizing radiation are going to damage your tissue. How these radiation are going to damage your tissue? Basically, they are going to produce the ionizing free radical. So these free radicals are going to damage the DNA. So ionizing radiation causes DNA double strand break and cellular damage both directly and indirectly to the production of free radical. So when you are getting the ionizing radiation, in after the radiation in your body, they are going to produce the free radical. These free radicals are going to damage the DNA and also cellular damage that can be directly or indirectly. Then there are different kind of complications that can arise after the radiation, but these complications depend on the dose of the radiation. If you are getting the more dose, the more complication will occur. If you are getting the less dose, the less complication will occur. So here they mention complication usually arises when the patient is exposed to significant doses, when the patient is going to expose to more doses. So here they give the example radiotherapy, nuclear reactor accident. So these are the examples in which you get the more radiation. Then after that we have the complications of the ionizing radiation. There are localized complications like inflammation and fibrosis can occur. Then also leukemia and thyroid cancer. In thyroid cancer, you will get the papillary thyroid cancer after the ionizing radiation. Then after that, what is acute radiation syndrome? Basically, it is the you can say the complication of radiation that usually develop after the ionizing radiation when you are going to expose your whole body under high doses of ionizing radiation. Then after exposing the body under high doses, you will get the nausea, vomiting, diarrhea, hair loss, erythema, redness, cytopenia, headache, and altered mental status. So these are the collection of symptoms which are collectively called syndrome, and you are getting this after the radiation, and that radiation you get you can say in acutely. So that's why it is called acute radiation syndrome, and it usually develop after the you can say sudden exposure of ionizing radiation. So that's why it is called acute. Then they can ask from you in the exam like what are the tissue that are going to be damaged more during the ionizing radiation injury. So basically these are the stem cells of regenerative tissues like skin, bone marrow, GI tract, and gonads. These are the more susceptible to radiation injury. You guys have to remember this. Then after that, the radiotherapy damage cancer cells more than healthy cells because the cancer cells have dysfunctional DNA repair mechanism in the addition to high replicative rate. So the question is basically they can ask from you in exam why the radiation is going to damage the cancer cell more than healthy cell. Basically the cancer cell don't have the DNA repair mechanism very good. So if the DNA repair mechanism is not good, so it's mean your cell is going under death, because if you not repair the DNA, your cell will undergo death. Then after that the cancer cell have a high replicative rate. So this is also another reason those cells which have the high replicative rate, the radiation is going to be effective more. So over tissue or over cells are not replicating more, and over cells have good DNA repair mechanism. So that's why over healthy cells are you can say going to be injured less. So this is the ionizing radiation toxicity.